Hi, this video is the FUE donor scar. This client had four FUE done, FUE surgery done in the past, and this is shaved with a clipper without a gar. The scar is there, but it's hard to see, and that's the great thing about the FUE. People worry about being model and all stuff, and it can be, but it's very hard to see, and depend on the size of the tip that you use. And but this is the demonstration of the FUE donor scar after 4 FUE surgery, and it still looks good, and he can shave his head and walk around without much detectability. Yes, the donor density is depleted. There's no way around it. I mean, that's the true meaning of a hair transplant, is you harvest the hair graft out and take it on the back to the front. But the way the tiny dots of scar are so small and scattered, that's hard to see. There's always pro and con for both FUE and FUT, and I perform both the FUE and the FUT. The FUE leave you tiny dots of scar, less invasive, less bleeding, less chance of infection compared to the strip method. And the downside of the FUE is the cost. It's more expensive. The number of grafts you do is less, 2,500 to 3,000 grafts. So if you have advanced hair loss, it's recommended to go with strip. However, you can get the FUE done. You just need to know it's multiple session. The other downside of the FUE is the growth rate. Now, you're going to have excellent growth rate with FUE and FUT, but if you compare that to the strip method, it's 5 to 10% less density. Not much of a difference at all, and you can't really tell with the eye. If you follow my work consistently, you know my FUE will have excellent density as well as the strip method. On the other hand, the strip method will leave you a linear scar from ear to ear, and it's permanent for the rest of your life. The strip method is not just a linear scar, but it's more invasive. We'll have to cut you open and suture you up. That means you have to remove the suture. It's more painful, more chance of infection. Recovery is slightly a little bit longer because we actually cut and suture. But the good part of the strip method is cheaper. And you can move 4 to 5,000 grafts per day, or sometimes higher, and it's very good for advanced hair loss. And most people nowadays don't really do the strip unless you have advanced hair loss pattern, class 4 or 5 or 6 or 7. And the other benefit of the strip is not just cheaper and you can move more, but the growth rate is better, 5 to 10% better density than the FUE. You can have excellent result with both FUE and FUT. So this is the demonstration of the FUE donor scar. Both FUE and FUT produce scar, but the FUE scar is harder to see. And this is after 4 FUE hair transplant surgery follow-up. Thank you.